In this section of Chapter 6, it discusses protein and health and disease, and we're going to talk about protein, energy, and malnutrition and its prevalence in children and adults. We're going to differentiate between the types of protein, energy, malnutrition. We're also going to discuss the potential risks associated with high protein diets, and also you're going to learn about how dietary proteins can trigger a food allergy. Let's first talk about protein, energy, malnutrition. This is a condition characterized by loss of muscle mass and fat mass. And this increases susceptibility to infection that results from the long-term consumption of either inefficient amounts of energy or insufficient amounts of protein or both. Protein is and we know that there are two types, kwashiorkor, that's a pure protein deficiency in which only protein is deficient, but marasmus is a form of protein, energy, malnutrition in the diet where total energy calories are insufficient, causing severe muscle wasting. So here the picture on the right is a picture of a little boy in Somalia, and he has a complete depletion of fat stores and of wasting muscle. And this can be devastating in infants and children because most of their brain growth takes place in the first year of life, and malnutrition in the first year can cause decreases in intelligence and learning ability that persist throughout an individual's life. The picture on the left is kwashiorkor, and that's seen in a child from Haiti, and it's characterized by a swollen belly, which results from fluid accumulating in the abdomen and fat accumulating in the liver. And growth is impaired, but because energy intake isn't necessarily low, the child might not appear extremely thin, but the lack of protein also causes poor immune function and increased infection, changes in hair color, and impaired nutrient absorption. Protein, energy. Let's talk a little bit about allergies versus intolerances, proteins and foods. So when we move to when protein from the diet is absorbed without being completely digested, it can trigger a food allergy. And the first time the protein is consumed and a piece of it is absorbed intact, it's not broken down in the small intestine, it stimulates the immune system. And when the same protein is consumed again, the immune system sees it as a foreign substance and mounts an attack, causing an allergic reaction. And allergic reactions cause symptoms throughout the body. It can be life-threatening, and proteins that typically are a cause for concern are proteins from milk, eggs, peanuts, tree nuts, wheat, soy, fish, and shellfish. And those are the most common food allergies. So the slide talks about it's an adverse immune response to a specific food. Side effects can be rash, respiratory distress, GI distress, and death, listing the most common allergies. And allergies to fruits and vegetables often occur later in life, but certainly less common. Celiac disease, a lot of people ask me about that. It's an allergy to the protein gluten found in wheat, rye, and barley. And symptoms are not immediate, and an allergy is difficult to diagnose. Remember, there's a difference between a food allergy and a food intolerance. A food intolerance is an adverse reaction to food, but it doesn't provoke the immune system. So how do we meet our protein needs, or how do we identify protein on food labels? So we're learning to get really familiar with the food labels. We see it on the nutrition facts panel. There's not a lot of emphasis on protein because in the American diet we get enough, or usually more than enough. Usually it just lists the grams of protein without any percent daily value for protein. And then in the ingredients list, that's where we usually see the protein foods listed, as well as sources of hydrolyzed protein or protein hydrolysates. And those are proteins that have been treated with acid or enzymes, and they add flavorings, flavor enhancers, stablers, and thickening agents for those that have protein allergies to certain foods. How do we meet our protein needs? Real quick, there wasn't a slide on high protein diets and health, but with the recent popularity in high protein, low carb diets for weight loss, it's raised a lot of questions about whether consuming too much protein can be harmful. As protein intake increases, so does the production of protein breakdown products such as urea. That extra nitrogen molecule has to be eliminated from the body by the kidneys. There's some research that suggests this increases the workload of the kidneys, which could potentially speed the progression of renal failure in people with kidney disease, but it's not clear whether a high protein diet increases the likelihood of developing kidney disease in those with normal kidney functions. But we do know that because the high protein diets increase the amount of waste that must be excreted in the urine, they also increase water loss. And for most people, that's not a big deal because their kidneys are able to concentrate urine, but it can be an issue for children or people that have trouble concentrating urine, or infants, that sort of thing. It's also been suggested that the high amounts of protein in a high protein low carb diet can affect calcium status and bone health. We know that protein is essential for healthy bones, but too much protein has been shown to increase the amount of calcium lost in the urine, so that you actually urinate out the calcium. And some studies are suggesting that the amount of calcium lost in the urine is greater when protein comes from animal rather than vegetable sources. So there are some findings that have contributed to the belief that high protein diets, especially those in animal protein, result in bone loss. But there's been really no clinical studies to support this idea. In fact, there's been some studies that say when calcium intake is adequate, that there's no significant issue with this. But we do know that increases in urinary calcium are associated with high protein diets, could lead to speculation that people develop kidney stones. And what kidney stones are, they're deposits of calcium and other substances in the kidney and the urinary tract. And this high concentration increases our likelihood of developing stones. So there are some studies that say that diets rich in animal protein and low in fluid can contribute to kidney stones, and that's where the idea of high protein diets can cause you to develop kidney stones comes from. But the best documented concern with high protein diets is related to the amount of protein consumed. They're typically high in animal products, which are high in saturated fat and cholesterol and low in fiber, and therefore increase our risk of heart disease. I mean, eating saturated fats will increase our risk of heart disease, even though you might lose weight from these high protein, low carb diets. They tend to be low in grains, vegetables, and fruit, and may increase our risk for certain types of cancer. So how much protein do we need then? So We need to balance the amount of protein that we need for building muscles and all of the things that protein does in our diet. So we need to balance it with our amount of nitrogen that we can excrete in the urine, feces, and sweat. So it's usually a balance of nitrogen intake versus output, and we want a zero equilibrium. There are some nitrogen balance studies that are used to estimate protein requirements, but that's not commonly done unless you're in an inpatient setting. So a positive nitrogen balance, how do we know if we're in it? We know if we're growing, infants, children, adolescents, pregnant women, people recovering from a protein deficiency or illness. All these people need nitrogen to do all of these body processes. These people retain the protein to make new tissues, blood, bone, skin, and muscle cells, so they don't excrete as much nitrogen as they take in because they're using it. A negative nitrogen balance is when the body is starting to degrade and break down protein to use the nitrogen in the protein molecule. This happens in people who are starving, burn victims, severe injuries, infections, fever. I would say post-surgical patients as well. And this is when their output exceeds their intake because their muscle and other body proteins are being broken down for energy. So here's a diagram of nitrogen balance. It compares the first person's in an equilibrium. Their nitrogen intake equals their output. The second person is a critically ill patient who's in a negative nitrogen balance. That means that there are more protein broken down, is being synthesized versus what's going in. And the third one is in a positive nitrogen balance. This is a pregnant person. There's growing occurring in the body, and they're using that nitrogen to develop their fetus. Here's a picture that shows how protein requirements change over life. Our protein needs per unit of body weight decrease as growth slows. So as we grow up, we don't need as much protein during the first year. We're growing rapidly, so we need larger amounts of protein. As growth rate slows through childhood and adolescence, per unit of body weight decreases, but we continue to need less protein. RDA is 0.8 grams per kilogram of healthy body weight for adults. With more weight, more protein may be needed for maintenance and repair. So a 70 kilogram adult needs about 56 grams of protein a day. And on average, we consume about 70. That's why it's not really an issue on the nutrition facts label. We know that higher needs are in infants, during pregnancy, during breastfeeding, lactation, after injury, and in athletes. Usually we add about 25 grams extra a day for pregnant or lactating women. And the acceptable macronutrient distribution range for protein is between 10 and 35% of our total calorie needs for protein. Protein quality talks a little bit about the types of proteins. Are they complete or incomplete? So high quality proteins are typically from animals and soy and quinoa. Incomplete proteins are typically from plant sources and requires to use complementary proteins. That's where we use a couple different to get all the protein or amino acids that we need. We want to choose proteins wisely. We want less saturated fats, cholesterol, sodium, leaner cuts of meat, low-fat, non-fat milk, peas and beans, and whole grains. Again, complementation, it's just mixing. It's how plant-based diets get all of their proteins by combining plant foods. Here's a picture of rice and beans, grains, nuts, and seeds, and how that's typically done. Our next section, we're going to talk about vegetarian diet. So I'll stop right here.